was shaving, and I was just looking in the mirror, and I just said, oh my God, am I going to live to see my children grow up? I want to see them grow up. And I just broke out sobbing. Hi, my name is Jeff. I'm from Rochester, Minnesota. I am married with 3 boys, and I was diagnosed in November. Actually, I had symptoms in November of 2022, and then I was officially diagnosed the end of January of 2023 with clear cell renal cell carcinoma. It's been a roller coaster ride with many, many sharp turns. Something I wanted to get off but couldn't. I was strapped in my seat, and I'm battling through it. And I would say I've successfully battled through it through support of family, friends, and online support groups. First symptoms I had was just days before my wife went to a conference out in Washington, D.C. I started to have lower flank pain on the left side. And I went out on the trip, and I had these 3-hour episodes where I would have not excruciating pain, but annoying pain. And I thought I had diverticulitis or something like that, some GI thing, or maybe a UTI. Because after a while it would just pass. And I think, okay. So then we came back from the trip, and there was kind of off and on pain. I didn't say anything to my wife. And then about the 20th of January, the pain came back. It was quiet for about a month or so. Then it came back, and then all of a sudden I had blood in my urine. And I thought, oh, this is serious. So I contacted my primary care physician, and I said, hey, Dr. Greenland, I need to have some tests. I think I have a urinary tract infection, even though I've never had one. I said, because it started in my left flank and now it moved into the front, kind of my abdominal pain. And I had the blood in the urine. So then we had a battery of tests, urine and blood tests, and they came back, and Dr. Greenland said, well, based on how your labs came back, you don't have a UTI. My guess is that you're either have passed or are passing a kidney stone. So I said, oh. But he said, I want to have you have a CT scan so that we verify where the stone is, that you have a stone, where it is, the size, and then just rule out anything more sinister going on. So I had the CT scan a couple days later, and sure enough, I had the kidney stone. I had a 6-millimeter kidney stone lodged at the bladder that wasn't going to pass, and that was the reason for my pain on the left and abdominal side. And being 6 millimeters, it wasn't going to pass on its own. So in addition to that, the surprise was I had a 5-centimeter mass on my right kidney, in my right kidney. So that's how it all came to be. I really didn't have a lot of symptoms, other than maybe fatigue before that and the left pain on the side of my body, left flank pain. But quite honestly, if it weren't for the kidney stone, I would have had no idea that I had kidney cancer, because the right side of my body had no pain, no symptoms whatsoever. It was all related to the kidney stone. My primary referred me to a urologist who specializes in kidney cancer tumors. And my primary felt, it's a small tumor. We're pretty sure it's cancer. We're like 85, 90% sure it's cancer. So we're going to get you set up with a urology consult. So I had that, had a discussion with the urologist, and they said, yep, we looked at it. We're 85 to 90% sure it's cancer. It's solid. It's got all the earmarks, your symptoms, blood tests, urine tests, etc. He said, based on where it was located on the upper right pole of the right kidney, he said, you really have a couple of options. One, you could have an open radical nephrectomy. We think we need to take the entire kidney out based on where uh, it is. So he said we could do an open procedure, um, a partial nephrectomy. We could attempt that first, but we'd have to do it from your back because of where the tumor is located. Your ribs are in the way in the front. We'd have to open you up from the back. It would be a major surgery. And there's always a likelihood that we would have to do a radical nephrectomy once we got in there. And they were kind of 50-50 on whether that would be needed. And they said the other option would be to have a radical nephrectomy, and we do it hand-assisted laparoscopically. So we went through the pros and cons of that, and I've had relatives and family members who've had kidney cancer, not in my direct line, but family connections. And I heard that procedure is painful to have an open procedure. And the doctor explained to me that the surgery itself is not a big deal, but you're going to have more pain, longer hospital stay, and you also have the risk of chronic pain because we're going to have to remove 2 of your ribs, and you're going to have chronic pain potentially down the road. Well, I don't do well with pain. So I said, not interested in that. And then, so we said, okay, based on the science and the medical specialist in urology and the societies, they say it's best with a 5 centimeter or less tumor mass that we have a kidney biopsy taken if you're going to have a radical nephrectomy, particularly because what would happen, there's about a 7 to 10% chance that we'd get in there and find out that it's not cancerous. After all, it looks that way, but it's benign. So we went through the pros and cons of having the biopsy. I say, yes, I want to have that, just confirm it. So that was scheduled about a week later. We went to Mexico in between all of this. I decided, having talked about it with the urologist and my wife, that I'm going to have the biopsy. And that showed up, confirmed. They said they had a good sample. And that confirmed that I had clear cell renal cell carcinoma as they had expected. I was surprisingly calm. I worked in the medical field. I was an administrator prior to retiring in laboratory and pathology. I talked to many physicians and lab personnel. So cancer and pathology was just something I was exposed to never as a patient. And I knew that having renal cell carcinoma wasn't a good thing because I had heard chemotherapy. I knew chemotherapy and radiation aren't very effective. So I knew, I'm up against something here. But I was calm. I talked to my wife about it, and maybe I was shell-shocked, but I kind of took it in stride. I was dealing with, I had a kidney stone I had to get rid of, and then I had to take out the tumor. And my thought was, I want it out of my body. I don't want to have cancer in my body. Really, my primary thought was, I just want to cut it out. That was my thing. And it took me probably, 3 or 4 months before it really hit me. After I had the procedure, the nephrectomy, that, oh my God, I have cancer. And how long am I going to live? Because when they started out the conversation, the urologist said, well, given that we think it's about stage 1 or 2 and grade 1 or 2, you would have a less than 5%, probably a 1% chance of recurrence. So that calmed me down, and I was like, I went into my appointment after having the CT scan with my primary, and the nurse looked at me and she said, you're surprisingly calm for your diagnosis, and you're laughing, you're smiling, joking with me and your wife, and he said, your blood pressure, I had to take it twice because it's 159 over 93. And my typical is 117 over 74. But I just kind of took it in stride, I guess. I didn't fall apart like I probably thought I would. It took me a couple months, 3 or 4 months for that to finally sink in. I had a surgery, the lithotripsy. I had the kidney stone blown to bits and removed. Then I went on vacation on February 4th for a week. And then I came back on February 13th. 2 days later, I had the biopsy. And then 2 days later, I had the radical nephrectomy on February 15th. So it happened really quickly. And it would have happened actually quicker hadn't it been for the vacation in Mexico. We got there at 6 o'clock, got all prepped for surgery. I'd had surgery before on a broken ankle, so I knew what the prep for surgery was like, the basic prep. And I thought, well, this is nothing compared to having to put my ankle back together from 4 pieces. So I went in there thinking, oh, okay, I have some knowledge of it. So I didn't have a lot of fear of it. And then, of course, they come in and nurse preps your belly, gets you all shaved. They wheel you in, put you under, and boom. 3 hours later, on the dot, I wake up and said, yep, surgery was successful. Everything turned out good. We removed the whole kidney. We'll admit you to the hospital. We expect a 2-night stay. Based on how things went, I ended up being in the hospital for 3 days. So it was 2 nights and 3 days. So I guess 3 nights. I'm sorry, 3 nights, because I had some chest congestion. Wasn't related to the kidney, but I just wasn't breathing as well as I should be, taking deep breaths after the anesthesia. Then I went home. After the surgery, then of course the pathologist took a look at it, and based on the frozen section, they said, yeah, we're pretty confident. The surgeon came and saw me that night during hospital rounds and said, yeah, based on what we see, our initial assessment, both his and the pathologist, was that, yeah, I still think it's a stage 1 or 2, grade 1 or 2. But the pathologist will render the final stage and grade when he completes the pathology review. So 5 days later, I get the pathology back and it says, nope, it was stage 3. The mass had protruded into the renal vein, so I had renal vein invasion, and the grade was more aggressive than they thought. It was grade 3. So that was a surprise. That was actually the big surprise, because prior to that, I was told by my primary and the urologist, we're looking at grade 1 or 2. It's probably the best of both worlds and less chance of having a recurrence. Let's get it out. You'll get on. This is just a speed bump in your life and you'll be fine. Well, now everything changed 5 days after surgery when I get the pathology report and said, no, it's stage 3 and grade 3. Based on the fact that the surgery went well, there were clear margins, they got it all. They're pretty confident. There was no lymph node involvement. They said, we don't recommend in your case that you have immunotherapy. We think this is going to take care of it. We'll just monitor you closely. We'll have a CT scan 3 months after surgery to establish a baseline, which they did. That was all clear. And then I've been on a 6-month surveillance schedule since that time, where I have a CT of the chest and the abdomen along with the lab work. And so far, I have had no detectable signs of recurrence from the CT scans and lab tests. I also don't kid myself into thinking that I have this thing licked, because I personally don't think I'm cured. I hear that other patients will say that I'm cured, or you read something, and are you ever really cured from cancer? Some cases you are, but with kidney cancer, if it's going to recur, it's usually going to be in the first 3 years. Well, I'm at the 2-year mark, and it can happen at 5 years, and 10 years it's happened, especially if you're stage 3, grade 3. So I think of myself as being cancer free, as far as being detectable on CT scans. There's no microcells that are detectable, but I don't think that I'm cured. I think I'm a survivor so far, but I don't think that I'm cured. And I don't know if I ever will be, if I ever mentally will think I'm ever cured based on the specifics of this particular cancer. Whereas my mother just went through breast cancer a year after my cancer was diagnosed, and I consider her cured based on the science and in that particular cancer. But in my case, I don't, and I don't think. Well, I don't know that. I'm not sure how many patients actually think they're cured. They just don't have anything popping up that's detected at this point. I was shaving, and I was just looking in the mirror, and I just said, "Oh my God, am I going to live to see my children grow up? I want to see them grow up." And I just broke out sobbing. And I get probably the first 6 months after my first CT scan, and I didn't have anything. So I thought, oh, so then each month, it just got progressively less that I talk about or thought about cancer. And now I'm to the point that I don't really think about it that much, to be honest. And what helped me through that is that I've just done a lot of research, talked to my physicians, nurses, did a lot of research from credible sources: American Cancer Society, National Kidney Foundation, American Urological Association. And then I signed up for 2 online support groups on Facebook, and just creating a family there really helped me through. 6 months into this, I was writing all this stuff down, and I wrote a book, and I thought, I'm writing all this stuff down. I should just write a book about this. So I wrote on a manuscript and said, I'd probably never publish it. Well, I ended up doing it, publishing it on Amazon, and I called it One Kidney, Dealing with Kidney Cancer. And I talk about how it goes through, the details, the medical details, but also my faith in God in dealing with it, and the diet that I have to have, just my whole, approach and outlook on life. And then after I've been on these, a couple of Facebook support groups, I just said, I'm going to create my own. So I created kidneycouch.com website, and then that is linked to a Facebook group. My wife has always been a great cook. We're not vegetarians. We eat more of a Mediterranean diet, which is more of a kidney-friendly diet. So, Cindy's always been focused on, not a lot of red meat, more vegetables, fruits, and, just a healthier lifestyle. And we're active, work out, and we're, go for walks every day together. But in my case, I ended up thinking, okay, what is my diet? What's it supposed to be? Because I'm dealing with kidney cancer, chronic kidney disease, stage 3A, and I had kidney stones, calcium oxalate stones. And the nephrologist told me, he said, well, you've got kidney stones. First time I've ever had kidney stones at the age of 61. So you have an 80% higher risk of having a kidney stone in the next 10 years. So you need to make some changes to your diet. So I had to go out and look and find kidney cancer diet, from my understanding, is pretty much, healthy eating, Mediterranean diet, chronic kidney disease is more Mediterranean diet as well. And then for the kidney stones, I have to avoid certain fruits, vegetables, potatoes, oxalates, all of that. So I had to bring everything together and find a diet. And I talked to a nutritionist who has expertise in nephrology. And she really helped me based on my lab results and, lifestyle and the conditions I have, stones and the chronic kidney disease, to develop a diet that I really stick to, the diet, exercise, and the weight. So, and that's helped me a lot. I feel great. Probably not be overconfident in my health, that things are just going swimmingly, because they were. Never had any issues before this. Um, and then just physically, I'm more physically active, less sedentary than I was before. I had an office job, and I just make sure I'm retired now, and I just make sure I'm active and lead a healthy lifestyle. Uh, but I don't look back with regrets, and I don't know that I've really lost anything. Um, Kind of like a bump in the road, and took a wrong turn for a short time, and now I'm back on track. I really think it's such a cliche thing, but you really have to approach things in a positive way. And I think the hope is that I was diagnosed with I did the hat trick. I had a kidney stone, kidney cancer, and chronic kidney disease stage 3, and I'm down to one kidney that isn't functioning, you know, as well as it should. But I think the hope is that, one, the kidney cancer, at least for me, has not recurred. My kidney is functioning just fine. I really can't tell now that I'm doing what I'm supposed to do with the diet and exercise. I really can't tell I have chronic kidney disease on most days. I definitely can't tell I have any cancer that's coming back, fatigue or anything like that. So I think at some point, it takes a while, but you get beyond the fact that the hope and despair and all is lost, and you're like, no, this was just a bump in the road. And there's hope. It's not a death sentence. It's not the end of your life or your lifestyle as you know it. Just a few tweaks.